Blob simulation 28. Same process, fresh set. Read the command first, scan the clues, build fast, lock and move. 20 questions, 30 minutes. Clock starts now. What determines the resting membrane potential? A physiologist studies why a resting neuron's membrane potential sits near 70 MV, close to the equilibrium potential for one particular ion. Read the command. What determines resting membrane potential? K plus dominant, most permeable at rest, sits near K plus equilibrium, NERS, NA-K, AT pace maintains gradient. The resting membrane potential of a typical neuron around dial 70 MV is determined chiefly by potassium. At rest, the membrane is most permeable to K plus because of open potassium leak channels, so the resting potential sits close to the potassium equilibrium potential, about 90 MV, given by the Nernst equation. The small resting permeability to Na plus pulls the actual value slightly more positive than pure K plus equilibrium. This is captured by the Goldman equation, which weights each ion by its permeability. The correct answer is E. The Na plus K plus ATPSEs is essential, but indirect, it pumps 3 Na plus out and 2 K plus in, maintaining the concentration gradients high K plus inside, high Na plus outside that make the diffusion potentials possible and contributes a small direct electrogenic component. This is why the membrane potential is so sensitive to extracellular K+. Hyperkalemia depolarizes the resting potential, and hypokalemia lowers it, affecting cardiac and neuronal excitability. The potassium-dominated resting permeability sitting near the K+ Nernst potential is the determinant. What is the diagnosis and the embryologic defect? A cyanotic newborn of a diabetic mother has severe cyanosis at birth. Echo shows the aorta arising from the right ventricle and the pulmonary artery from the left ventricle, creating two parallel circuits. Survival depends on mixing AAPDA or septal defect. Read the command, diagnosis and embryologic defect. Cyanotic newborn, aorta off RV, PA off LV, parallel circuits, diabetic mother, transposition of great arteries, failure of aorticopulmonary septum to spiral. This is transposition of the great arteries DTGA. The embryologic defect is failure of the aorticopulmonary spiral septum to espiral during truncus arteriosus division. As a result, the aorta arises from the right ventricle and the pulmonary artery arises from the left ventricle. This creates TW parallel, separate circulations. The oxygenated systemic blood returns to the right heart and goes right back out the aorta to the body, while oxygenated blood cycles uselessly between the lungs and left heart. The correct answer is D. These parallel circuits are incompatible with life unless there is a shunt for mixing, a patent ductus arteriosus, patent foramen ovale, or VSD. So management is to keep the ductus open with prostaglandin E1 and often a balloon atrioseptostomy until surgical arterial switch. TGA is associated with maternal diabetes. It presents with severe early cyanosis, a cyanotic congenital heart disease. Note, it is a T lesion, the failure of the spiral septum producing aorta. Off RV and pulmonary artery off LV is transposition of the great arteries. Which enzyme is matched correctly to its function in DNA replication? A biochemistry student studies the enzymes that copy DNA at the replication fork. Read the command. Which replication enzyme matches its function? Helicase unwinds. Primase makes RNA primer. Polymerase synthesizes 5' plus proofreads. Ligase seals. Topoisomerase relieves supercoils. The replication fork uses a coordinated set of enzymes. Helicase unwinds and separates the double helix at the origin. Single-strand binding proteins keep the strands apart. Topoisomerase DNA gyrase in bacteria relieves the supercoiling tension created ahead of the fork. Primase synthesizes a short RNA primer to provide a free 3-OH. DNA polymerase then extends the new strand in the 5 to 3 direction, and many polymerases proofread with the 3 to 5 exonuclease activity to correct errors. The correct answer is C. Because polymerase only builds Fa3, the lagging strand is made discontinuously as Okazaki fragments. DNA ligase then seals the nicks between fragments, joining them into a continuous strand. Clinically, these enzymes are drug targets. Fluoroquinolones inhibit bacterial topoisomerase DNA gyrase. The correct pairings: helicase unwinds, primase primes, polymerase synthesizes and proofreads, ligase seals, topoisomerase relieves supercoils is the answer. Which artery supplies which gut region? A surgeon reviews the 3 unpaired arteries supplying the gut and how they map to the embryonic divisions of the digestive tract. Read the command. Which artery supplies which gut region? Celiac foregut, SMA midgut, IMA hindgut. The gut tube is supplied by 3 unpaired anterior branches of the aorta, each mapping to an embryologic division. The celiac trunk supplies the foregut, the esophagus, abdominal, stomach, proximal duodenal to the level of the major papilla, plus the foregut derivatives, liver, gallbladder, pancreas, and spleen. The superior-mesenteric artery, SMA, supplies the midgut, the distal duodenum, jejunum, ileum, cecum, appendix, ascending colon, and the proximal 2/3 of the transverse colon. Correct answer is B. The inferior mesenteric artery IMA supplies the hindgut, the distal 1/3 of the transverse colon, the descending and sigmoid colon, and the upper rectum. The transition points matter clinically. The SMA-IMA watershed at the splenic flexure between midgut and hindgut supply is vulnerable to ischemic colitis, and the SMA also marks the level where it can compress the duodenum, SMA syndrome, or be the embolic site for acute mesenteric ischemia. The celiac foregut, SMA midgut, IMA hindgut mapping is the answer. What is the diagnosis and mechanism? A 7-year-old boy develops dark, cola-colored urine, facial periorbital edema, and hypertension about 2 weeks after a sore throat, or 3-4 weeks after impetigo. Labs: hematuria with RBC casts, mild proteinuria, and LOW serum complement 1cc3. Biopsy shows lumpy bumpy C3. Read the command, diagnosis, and mechanism. Child, cola urine, plus edema, plus HTN2, weeks post-strep, RBC cast, low C3, subepithelial humps, post-streptococcal glomerulonephritis. Thesis post-streptococcal glomerulonephritis, PSGN, a classic nephritic syndrome. It follows infection with nephrogenic strains of group. A beta hemolytic streptococcus typically about 2 weeks after pharyngitis, or 3 to 6 weeks after impetigo skin infection. The mechanism is immune, complex mediated, type 3 hypersensitivity, streptococcal antigen, antibody complexes deposit in the glomeruli, activating complement and consuming it, hence the low serum C3. The correct answer is A. The presentation is the nephritic picture, cola, colored T-colored urine from hematuria, red blood cell casts, mild proteinuria, periorbital edema, and hypertension from saltwater retention. Light microscopy shows hypercellular glomeruli. Immunofluorescence shows a granular starry sky pattern, and electron microscopy shows the characteristic subepithelial humps. In children, it is usually SE self-limited with supportive care and good recovery. Adults do worse. The immune complex nephritic syndrome with low C3 and subepithelial humps after strep is post-streptococcal glomerulonephritis. What is this mechanism, and how does it respond to HIEH distal nickel? A renal physiologist studies how each nephron autoregulates its own filtration. Specialized cells in the distal tubule sense the sodium chloride in the fluid and signal the nearby afferent arteriole. Read the command, mechanism, and response to high distal NSL. Tubuloglomerular feedback, macula densa senses NACO, high NACO, adenosine. Sound, afferent constriction, Phi-on GFR. This is tubuloglomerular feedback, a key intrinsic autoregulatory mechanism that keeps each nephron's GFR relatively constant. The sensor is the macula densa, specialized cells in the early distal tubule that sit against the afferent arteriole and sensi, the sodium chloride concentration of the tubular fluid. The NACO delivered to the macula densa is a proxy for the filtration rate of that nephron. Correct answer is B. The response is a negative feedback loop. When distal NACO delivery is hitch indicating GFR is too high, the macula densa releases adenosine, which constricts the efferent arteriole, lowering glomerular pressure and bringing GFR back down. Conversely, when distal NACL is low GFR, too low, the macula densa signals to dilate the afferent arteriole and stimulates the juxtaglomerular cells to release renin, activating angiotensin II, which constricts the efferent arteriole, both raising GFR. The macula densa-driven afferent constriction in response to high NACL is tubuloglomerular feedback. Which statement about direct arteriolar vasodilators is correct? A patient with severe hypertension is given hydralazine, and a pregnant patient with preeclampsia receives it as well. It directly relaxes arteriolar smooth muscle. A reflex effect limits its use as monotherapy. Read the command. Which direct vasodilator statement is correct? Hydralazine relaxes arterioles. EE afterload, reflex tachycardia, plus fluid retention. Used in pregnancy, drug-induced lupus. HYD ralazine is a direct arteriolar vasodilator. It relaxes arteriolar smooth muscle more than venous, reducing systemic vascular resistance and afterload. The main limitation is compensatory reflex. The drop in blood pressure triggers baroreceptor-mediated reflex tachycardia, which can provoke angina and activates the renin-angiotensin system, causing sodium and fluid retention. Because of this, hydralazine is usually combined with a beta blocker to blunt the reflex tachycardia and a diuretic act to counter fluid retention. The correct answer is D. Clinically, hydralazine is useful in hypertensive emergencies and is a preferred agent in pregnancy, preeclampsia, along with labetalol and methodopa. It is also used with nitrates in heart failure, notably in Black patients. A classic toxicity is a drug-induced lupus-like syndrome along with procainamide and isoniazid, the slow acetylator association. A related agent, minoxidil, opens K-pus channels to dilate arterioles and grows hair. The arteriolar dilation with reflex tachycardia, fluid retention, and drug-induced lupus risk is the correct hydralazine profile. What is the diagnosis, the hormonal metabolic mechanism, and a key long-term risk? A 26-year-old woman has oligomenorrhea, hirsutism, acne, and difficulty conceiving. She is overweight with acanthosis nigricans. Labs, elevated LH-FSH ratio, high androgens, testosterone, and ultrasound shows multiple peripheral ovarian follicles. She has insulin resistance. Read the command, diagnosis, mechanism, long-term risk. Oligomenorrhea plus hirsutism plus the LH, FSH plus the androgens plus insulin resistance. PCOS, unopposed estrogen, endometrial cancer. This is polycystic ovary syndrome, PCOS, the most common cause of anovulatory infertility. The mechanism links hormones and metabolism. Insulin resistance and hyperinsulinemia plus an elevated LH drive stimulate the ovarian theca cells to produce excess androgens ATR-sutism, causing hirsutism, acne, and anovulation with oligomenorrhea. Hyperinsulinemia also lowers sex hormone-binding globulin, raising free androgens further. The classic labs are an elevated LH-FSH ratio and high androgens, with ultrasound showing numerous small peripheral follicles. The correct answer is D. The KUE long-term risk is the high-yield twist. Chronic anovulation means the endometrium is exposed to estrogen that is unopposed by progesterone, no corpus luteum forms, driving endometrial hyperplasia and raising the risk of endometrial carcinoma. PCOS also predisposes to type 2 diabetes, metabolic syndrome, and dyslipidemia. Management. White's lost first line combined oral contraceptives regulate cycles, protect the endometrium, lower androgens, metformin insulin sensitizer, and letrozole clomiphene for fertility. The insulin resistance and androgen excess syndrome with endometrial cancer risk is PCOS. Which fungus is responsible? A 30-year-old construction worker in Arizona, the San Joaquin Southwest Desert, develops fever, cough, fatigue, arthralgias, desert rheumatism, and erythema nodosum after a dust storm. Tissue shows large spherules filled with endospores. Read the command. Which fungus? Southwest desert, dust exposure, spherules with endospores, desert, rheumatism, erythema nodosum, Coccidioides immitis. This is Coccidioides immitis, and C. Posarasis, a dimorphic fungus endemic to the southwestern United States, especially the deserts of Arizona, Southern California, San Joaquin Valley, Valley FIBA, and New Mexico. Infection occurs by inhaling. Arthroconidia spores stirred up in DUST. Outbreaks follow dust storms, earthquakes, and excavation. In the warm soil, it grows as a mold arthroconidia, but in TISSU, at body temperature, it transforms into characteristic large spherules packed with endospores. The diagnostic histologic finding. The correct answer is E. The clinical picture is classic. Most infections are a self-limited flu-like pneumonia, but it can present with the triad of fever, arthralgias, D-cert rheumatism, and erythema nodosum, a hypersensitivity reaction signaling a good immune response. It can disseminate to skin, bone, meninges, especially in immunocompromised or certain ethnic groups, and in pregnancy. Treat with azoles, fluconazole, or amphotericin for severe disease. The dust-acquired spherule and endospore fungus of the southwestern deserts is Coccidioides immitis. Which conversions and enzymes are correct? A physiologist studies how testosterone is converted to its more potent and to its different downstream hormones in target tissues. Read the command. Which conversions enzymes are correct? Testosterone and DHT 5-alpha reductase more potent, and D-estradiol aromatase finasteride blocks 5-alpha reductase. Testosterone is the main circulating androgen, but in target tissues it is converted into two important products by two enzymes. 5-alpha. Reductase converts testosterone into dihydrotestosterone DHT, which is the more potent androgen at the receptor. DHT is responsible for development of the male external genitalia and prostate, and later for prostate growth, BPH each, male pattern, baldness, and sebaceous activity. Aromatase converts testosterone and androstenedione into estrogen estradiol, occurring in adipose tissue, the brain, bone, and gonads. The correct answer is A. This pharmacology is high yield. Finasteride inhibits 5-alpha reductase, lowering DHT used for benign prostatic hyperplasia and male pattern baldness. Aromatase inhibitors. Anastrozole, letrozole block estrogen synthesis, used in estrogen receptor-positive breast cancer. The embryology is also testable. Testosterone drives the Wolffian mesonephric ducts, while DHT drives the external genitalia prostate, so 5-alpha reductase deficiency causes ambiguous genitalia at birth that virilize at puberty. The 5-alpha reductase to DHT and aromatase to estradiol conversions are the answer. What is the diagnosis and the bone cell mechanism? A 68-year-old man has an enlarging hat size, bone pain, and hearing loss. Labs: markedly elevated alkaline, phosphatase with normal calcium and phosphate. X-ray shows a mosaic jigsaw, bone pattern with both lytic and sclerotic areas. He is at risk for high-output heart failure and osteosarcoma. Read the command. Diagnosis and bone cell mechanism. Enlarging hat size, bone pain, SACA ALP, with normal CACA-PO4, mosaic bone. Paget disease, SACA osteoclast and disorganized osteoblast remodeling. This is Paget disease of bone, a disorder of disordered bone remodeling in older adults. The mechanism passes through phases. First, an osteoclastic lytic phase of excessive bone resorption, then a mixed phase, then an osteoblastic sclerotic phase of disorganized bone formation, leaving thick but structurally weak, poorly organized bone with the characteristic mosaic jigsaw lamellar pattern. The hyperactive bone turnover markedly raises alkaline phosphatase, while serum calcium and phosphate are characteristically normal. The correct answer is A. The clinical clues and complications are classic. Skull involvement enlarges the head, increasing hat-sized eyes, and can compress cranial nerves, causing hearing loss. The bones are painful and prone to fracture and bowing. The increased vascularity of pagetic bone can cause HIG-HPU cardiac failure. The most feared complication is malignant transformation to osteosarcoma. Treat with bisphosphonates, which inhibit the overactive osteoclasts. The high alkaline phosphatase, normal calcium, mosaic bone remodeling disorder is Paget disease of bone. Which hypothalamic nucleus is matched correctly to its function? A neuroanatomist asks about the functions of specific hypothalamic nuclei. Read the command. Which hypothalamic nucleus matches its function? Lateral hunger, ventromedial satiety, anterior cooling parasympathetic, posterior heating asympathetic, suprachiasmatic acircadian, supraoptic paraventricular, ADH oxytocin. The hypothalamus has discrete nuclei with specific jobs. The lateral nucleus drives hunger. Lateral lacking food makes you hungry. Destroying it causes anorexia and weight loss. The ventromedial nucleus drives SATD, ventromedial very much satisfied. Destroying it, EEG, a craniopharyngioma or trauma, causes hyperphagia and obesity. For temperature, the anterior hypothalamus mediates CO-oling and parasympathetic responses, HEC, anterior cooling. Its lesion causes hypothermia. The posterior hypothalamus mediates heating and sympathetic responses. Its lesion causes poikilothermia. The correct answer is E. The remaining high-yield nuclei, the suprachiasmatic nucleus, regulates circadian rhythm, receives retinal input, controls the sleep-wake cycle, and melatonin. You need sleep to be charismatic. The supraoptic nucleus makes ADH vasopressin, and the paraventricular nucleus makes oxytocin, both released from the posterior pituitary. The trap options swap hunger satiety and heating cooling. The lateral hunger, ventromedial satiety, anterior cooling, posterior heating, suprachiasmatic circadian set is the correct match. What is the diagnosis, the symptom categories, and the duration criterion? A 22-year-old man over the past 8 months has developed auditory hallucinations, the fixed false belief that the government is monitoring him, delusions, disorganized speech, and social withdrawal with flat affect. There is no major mood episode or substance use. Read the command, diagnosis, symptom categories, duration. Hallucinations, plus delusions, plus disorganized speech, plus negative symptoms. 6 months, schizophrenia, positive versus negative, dopamine. This is schizophrenia. The diagnosis requires at least TW of the 5 core symptoms, with at least one being a positive core symptom, delusions. Hallucinations, often auditory, disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms. These divide into positive symptoms, added experiences, hallucinations, delusions, disorganized speech behavior, and negative symptoms, deficits, flat A effect, abolition, alogia, anhedonia, asociality. The correct answer is C. The duration criterion separates the psychotic disorders along a timeline. Brief PSY psychotic disorder lasts less than 1 month, often after a stressor. Schizophreniform disorder lasts 1 to 6 months, and schizophrenia requires symptoms for at least 6 months, with at least 1 month of active symptoms. The dopamine hypothesis underlies treatment. Antipsychotics block D2 receptors. Positive symptoms respond best. There's 2 core symptoms with positive and negative categories lasting at least 6 months is schizophrenia. What is the diagnosis, the transport defect, and why does it mimic pellagra? A child has a pellagra-like rash, photosensitive dermatitis, cerebellar ataxia, and neuropsychiatric symptoms, but a normal diet. Urine shows excess neutral amino acids. The defect is in a transporter in the intestine and kidney. Read the command, diagnosis, defect. Why pellagra-like? Pellagra-like rash plus ataxia plus neutral amino aciduria. Hartnup disease, neutral amino acid transporter defect, low tryptophan, low niacin. This is Hartnup disease, an autosomal recessive disorder of amino acid transport. The defect is in the neutral amino acid transporter, the SLC6A19 transporter, in the proximal renal tubule and the small intestine, which normally reabsorbs neutral amino acids, including tryptophan. With the transporter defective, neutral amino acids are lost in the urine, neutral amino aciduria, and poorly absorbed from the gut. The correct answer is C. The reason it mimics pellagra is the high-yield link. tryptophan is the precursor the body uses to synthesize niacin vitamin B3. Losing tryptophan therefore causes a functional NiACN deficiency, producing pellagra-like features, the 3Ds, dermatitis, a photosensitive rash, and cerebellar ataxia, neuropsychiatric symptoms, the 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 1-ominix LK. Treatment is NiACN supplementation and a HIH protein diet to overcome the malabsorption. The neutral amino acid transporter defect causing tryptophan loss and secondary niacin deficiency is Hartnup disease. What is the diagnosis, the mechanism, and an associated risk? A 55-year-old woman has 6 months of dry eyes, gritty sensation, a dry mouth with difficulty swallowing dry food and dental caries, and bilateral parotid enlargement. Labs, positive anti-Rho DSSA and anti-La SSB antibodies. Lip biopsy shows lymphocytic infiltration of salivary glands. Read the command, diagnosis, mechanism, associated risk. Dry eyes plus dry mouth plus parotid enlargement plus anti-Rolla. Sjogren's syndrome, lymphocytic exocrine destruction, mouth lymphoma risk. This is Sjogren's syndrome, an autoimmune disease characterized by LYMphocitic infiltration and destruction of the exocrine glands, principally the lacrimal and salivary glands. Destruction of the lacrimal glands causes DRY-EYE's keratoconjunctivitis sicca, a gritty sandy sensation, and destruction of the salivary glands causes DRY-mutes, exorostomia, difficulty swallowing dry food, dental caries, and parotid enlargement. It is most common in middle-aged women and can be primary or secondary to another autoimmune disease like rheumatoid arthritis. Correct answer is B. The serology is classic. Anti-Rho SSA and anti-Lay SSB antibodies. Anti-Rho also matters in pregnancy. Risk of neonatal lupus congenital heart block. Lip minor salivary gland biopsy confirms the focal lymphocytic chaliadenitis. The KEV associated risk, remember, is a markedly increased incidence of BCEL lymphoma, specifically malt marginal zone lymphoma. So new unilateral firm parotid swelling warrants evaluation. The autoimmune exocrine gland destruction causing sicca symptoms with anti-Rolla and malt lymphoma risk is Sjogren's syndrome. Which set of changes occurs during exercise? A physiologist studies the cardiovascular and metabolic responses during moderate aerobic exercise. Read the command, which exercise changes occur. CO, pressure. Local metabolites dilate muscle. Flow. AV, O2, difference widens. MAP rises modestly. During dynamic aerobic exercise, the cardiovascular system delivers more oxygen to working muscle. Cardiac output rises substantially through increases in both heart rate and stroke volume, enhanced contractility, and venous return. In the active muscle, accumulating local metabolites. Adenosine, CO2, H+, K+, and falling O2 cause arteriola. Vasodilation, active hyperemia, markedly increasing muscle blood flow, so total peripheral resistance actually falls overall despite sympathetic activity elsewhere. The correct answer is D. The tissue extracts MORE oxygen, so the arteriovenous oxygen difference widens venous O2 content drops as muscle pulls more O2 from blood. Systolic pressure rises higher stroke volume, while diastolic stays about the same, so Puller's pressure widens and mean arterial pressure increases modestly. Sympathetic activation raises heart rate and redistributes flow away from gut-kidney toward muscle. The increased cardiac output, metabolite-driven muscle vasodilation, and widened AVO2 difference are the changes of exercise. What is the diagnosis? A 50-year-old woman has new onset seizures and headaches. MRI shows a well-circumscribed, dural-based, extra-axial mass that enhances homogeneously with a dural tail. Histology shows whorls of cells and laminated calcifications, psammoma bodies. It arises from arachnoid cells. Read the command. Diagnosis. Dural-based extra-axial mass, dural tail, whorls, plus psammoma bodies, arachnoid origin, woman, meningioma. This is a meningioma, one of the most common primary brain tumors in adults and usually benign and slow-growing. It arises from arachnoid meningophilial cap cells of the meninges, so it is E-extra, axile outside the brain parenchyma, and attached to the dura. On imaging, it is a well-circumscribed dural-based mass that enhances homogeneously and classically shows a dural tail. It is more common in women, expresses progesterone receptors, and its incidence rises with age. Correct answer is B. The histology is the giveaway. Spindle cells arranged in whorls and syncytial nests, often with laminated calcified PSM monobodies. Because it compresses rather than invades the brain, it often presents with SEIZers, headaches, or focal deficits depending on location, and may be found incidentally. Treatment is surgical resection radiation, with a generally good prognosis. The benign, dural-based, extra-axial arachnoid cell tumor with whorls and psammoma bodies is a meningioma. Which statement about cholinesterase inhibitors is correct? A patient with myasthenia gravis is treated with pyridostigmine. A patient with Alzheimer's dementia takes donepezil. A post-operative patient receives neostigmine to reverse neuromuscular blockade. Read the command. Which cholinesterase inhibitor statement is correct? Block ACE, 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 ACE uses myasthenia, blockade reversal, Alzheimer, overdose, cholinergic crisis, dumbbells, atropine reverses. Cholinesterase inhibitors anticholinesterases work by inhibiting acetylcholinesterase, the enzyme that breaks down acetylcholine, so they increase acetylcholine levels and prolong its action at both muscarinic and nicotinic synapses. Their therapeutic uses follow from this. In myasthenia gravis, pyridostigmine and neostigmine boost neuromuscular transmission. Neostigmine reverses non-depolarizing neuromuscular blockade after surgery, and in Alzheimer's disease, the centrally acting donepezil, rivastigmine, and galantamine modestly improve cognition. CNS acetylcholine is low in Alzheimer's. The correct answer is E. The toxicity is the predictable cholinergic excess. Acetylcholinergic crisis captured by dumbbells, diarrhea, urination, meiosis, bronchospasm, bradycardia, excitation, skeletal muscle, CNS, lacrimation, and salivation, sweating, so they cause meiosis and WET iterations, the opposite of antimuscarinics. This is treated with atropine muscarinic antagonist, and for organophosphate poisoning, amuscarinic antagonist, and for organophosphate poison, the acetylcholinesterase inhibition raising acetylcholine, useful in myasthenia, Alzheimer, and blockade reversal with the dumbbells. Cholinergic crisis toxicity reversed by atropine is the correct statement. Which virus is responsible, and what is its family? During a summer outbreak, an unvaccinated child develops fever, sore throat, and then asymmetric flaccid paralysis of one limb with absent reflexes but preserved sensation. CSF shows lymphocytic pleocytosis. The virus destroys anterior horn motor neurons. Read the comment. Which virus and family? Asymmetric flaccid paralysis, intact sensation, anterior horn destruction, summer fecal, oral, poliovirus, enterovirus, pyronavirus. This is poliovirus, a member of the enterovirus genus within the picornavirus family. Small, naked, positive-sense, single-stranded RNA viruses. It is transmitted by the fecal-oral route, replicates in the gut and lymphoid tissue, then can spread to the central nervous system, where it specifically destroys the anterior horn motor neurons of the spinal cord, lower motor neurons. The correct answer is C. Because it kills lower motor neurons, the paralysis is flaccid, asymmetric, and accompanied by absent reflexes and muscle atrophy, but sensation is preserved. The sensory tracts are spared. The septic meningitis. Quote, the CSF shows a lymphocytic pleocytosis, a septic meningitis pattern. Other enteroviruses are high yield. Coxsackie viruses cause a septic meningitis, myocarditis, pericarditis, herpangina, and hand-footingitis, myocarditis, parenchyma, and hindfoot and murine. Polio is prevented by vaccination, Salk inactivated, Sabin oral. The anterior horn, destroying fecal oral enterovirus causing flaccid paralysis with intact sensation is poliovirus. Which statement about B-cell versus T-cell development is correct? An immunology student compares where B and T lymphocytes are made and mature, and how they recognize antigen. Read the command, which B-cell versus T-cell development statement is correct. Both from bone marrow, B mature in marrow, recognize free antigen, T mature in thymus, positive negative selection, MHC restricted. Both B and T lymphocytes originate from hematopoietic stem cells in the bone marrow. The difference is where they matter. B cells mature in the bone marrow itself, B for bone marrow. Once mature, they recognize antigen through their surface immunoglobulin B-cell receptor and can bind free native antigen directly. Upon activation, they differentiate into plasma cells that secrete antibody humoral immunity. The correct answer is A. T yields leave the bone marrow as immature precursors and migrate to the thymus to mature T for thymus. There they undergo positive selection in the cortex, keeping T cells whose receptors can bind self, MHC, and negative selection in the medulla, deleting T cells that react too strongly to self-antigen, central tolerance. Mature T cells recognize antigen only when it is presented on MHC molecules, MHC restricted, CD4 with MHC2, CD8 with MHCI, a shared bone marrow origin with B cells maturing in the marrow and T cells maturing in the thymus. MHC restricted is the correct statement. Block 28 is done. Let's review the 5 biggest traps from this block. Trap 1. The resting membrane potential sits near -70 because the membrane is most permeable to potassium at rest, so it floats near the potassium equilibrium potential. The sodium-potassium pump maintains the gradients but doesn't set the value directly. Trap 2. Transposition of the great arteries comes from a spiral septum that failed to spiral, aorta off the right ventricle, pulmonary artery off the left. The two circuits run in parallel and need mixing. Keep the ductus open with prostaglandin E1. Trap 3. The macula densa senses distal sodium chloride. High delivery means GFR is too high, so it releases adenosine to constrict the afferent arteriole and bring GFR back down. Low NACO does the opposite and triggers renin. Trap 4. PCOS combines insulin resistance and excess androgens, but the long-term trap is chronic anovulation. Unopposed estrogen on the endometrium raises endometrial cancer risk. That's why you protect the endometrium with oral contraceptives. Trap 5. Both lymphocytes are born in the bone marrow, but B cells mature there while T cells migrate to the thymus for positive and negative selection. T cells are MHC restricted, B cells recognize free antigen and make antibody. "28 blocks, 560 questions, train process, not memorization. StepLogic, learn how to think, not memorize."